Guys, it's Dr. Greer here, and I want to talk a little bit about spider veins. Spider veins are those little red or blue or purplish veins that look like a spider web, and they can occur on the legs or even the face. Those are the two most common areas. So what causes those? Spider veins occur when the pressure in your veins gets higher because they're not emptying, or it can occur as a result of damage. So if you're on your feet a lot, you may notice spider veins, or if you're pregnant, because that increases pressure on the veins because of the growing baby. On the face, sun damage is a really common cause. It builds up over the years, and then when you're in your 40s and 50s, you start to see those little spider veins develop around your nose, around your mouth, and even on your cheeks. You can also see them after an injury or a cut, or if I do a skin cancer excision or even a facelift, sometimes I'll see spider veins develop there. So that's what they are. They're different than the big ropey varicose veins that kind of bulge out. Spider veins don't tend to hurt, or you may not even notice them at all, whereas varicose veins can itch or ache or make your legs feel tired. If you have the big varicose veins, you need to treat those first, because until you treat those, more spider veins will keep popping up. And varicose veins are usually treated by a vein specialist. Spider veins can be treated by a vein specialist and are commonly treated by plastic surgeons and dermatologists. So if you don't have any of the big ropey varicose veins and you just have the little spider veins, they're very easy to treat. There's two different treatment options: sclerotherapy, which is injecting a medication that makes the vein scar shed. It's called a sclerant, which means scar, or laser treatments are my go-tos. On the face, I generally use laser, and on the legs, I generally use sclerotherapy. And the reason is laser is not as effective on the legs because it's a higher pressure system. We don't generally do sclerotherapy in the face, I think just because laser is so effective and easy and you're not getting lots of little needle pokes. Most people will need a couple of treatments to completely clear them up, but you will see a really significant difference after one treatment. I mean, up to 80 or 90% improvement. Treatments are done right in the office. And for the face, we will put a cold ultrasound gel over the treatment area that helps protect your skin, and it will conduct the energy of the laser. During the actual treatment, you'll feel little like rubber band snaps or even a flash of heat. And afterward, you may have a little bit of swelling or bruising, or it may feel a little itchy. For sclerotherapy, I use a very tiny needle to inject the medicine directly into the veins. So you'll feel little needle pinches, and you may feel a light burning sensation if the medication is going into a bigger vein system. It's generally about a half-hour treatment for both. And like after treating the face, on the legs, you may notice some itching and swelling. It can almost look like hives. That goes down after a couple of hours. It will take a few weeks to see resolution of the veins. On the face, it's a little bit faster. You may have bruises for a couple weeks, but then they fade pretty quickly. On the legs, you can get what's called hemosiderin staining. And hemosiderin is the compound that gives blood its color, and that's what causes bruises to be brown and purple. That takes a little bit longer for your body to break down in the legs because there's less blood flow than in the face. So it can take a few weeks where you may just have like a light bruise or a brownish discoloration. It does eventually go away, but BBL treatments with the laser can help speed that process up. Now, other questions I hear, what is the recovery like? There's generally no recovery for either treatment, though you'll want to cover bruises up on the face with makeup, which you can do right away. I do recommend you avoid exercising for a couple of days after, because exercise will cause vasodilation. It will flush your face, which can put more pressure on those spider veins and make them open back up. And same thing in your legs, it's going to increase blood flow and can make those veins pop open. So I would avoid exercising for about 3 days afterward. Same thing with really hot showers or hot tubs. Those are going to make vasodilation occur. And the other thing I ask you to refrain from or abstain from is alcohol for about 3 days after treatment. Other than that, you can do your normal routine and there's no real downtime. In terms of risk, the most common complication that can occur with either injection or laser treatment is you get a little scab and it could leave a scar. For the laser treatment, that happens just if there's too much heat applied to one area, it can leave a tiny little burn. The scar is pretty subtle if it does happen. It's similar to an acne scar. And on the leg, you can get some scabbing too if the medication diffuses out into the tissue rather than the vein. Again, not super common, and generally if you do get a scab, it heals pretty darn well. I do want you to know that spider veins tend to recur after a while, so don't be surprised if you need a repeat treatment a few years down the road. One other time you may see them recur is if you have another pregnancy. So I've treated my spider veins after each baby. They do get better after the baby's delivered, but if they don't completely go away, that's a time when you want to treat them again. Otherwise, it may be a good 2 to 3 years before you notice new ones start to develop. So it is kind of a maintenance treatment, but definitely longer between treatments. So final question is cost, and you're usually looking at a few $100s. In our office, we simply charge by time. So if you're coming in just for a vein injection, it could be anywhere from 20 to 30 minutes. So you're looking at a few $100 depending on total time involved. And often if I do a really extensive treatment with a lot of spider veins, we'll include a touch-up in that cost, just so you can come back and get any little ones where the treatment didn't take right away. So that's all the info I have for you on vein treatment. If you have any questions about spider veins, I would love to hear them. Leave them in the comments and I will be sure to leave some answers for you, and hit subscribe or follow so that you don't miss the answers.